Right now, as you're sitting there watching this, I want you to gently look down at your legs and feet. I know that sounds simple, but for millions of seniors, that's exactly where the very first warning signs of serious heart trouble quietly appear. Most people shrug it off. They say, it's just age, or I was on my feet too long today. But the truth is far more serious. In the United States alone, over 6 million people live with heart failure, and it remains the number one reason seniors are hospitalized. What many don't realize is that long before chest pain or emergency symptoms show up, the heart often sends its earliest distress signals to the lower body. According to the American Heart Association, fluid buildup and circulation changes caused by a weakening heart almost always show up first in the legs and feet. Gravity pulls excess fluid downward, and when the heart can't pump efficiently, the lower body becomes the warning zone. If even two or three of the signs I'm about to describe feel familiar to you or someone you love, please don't ignore them. Early action can literally change the course of your life. Symptom number 1. Persistent swollen ankles and feet. Edema. The number one gravity clue. When your ankles or feet stay swollen day after day, this is not just a cosmetic issue, and it's not something that should be brushed off as normal aging. Persistent swelling, medically known as edema, is one of the clearest and earliest warning signs that your heart may be struggling. I want you to picture what's happening inside your body. Your heart's job is to pump blood forward with enough strength to circulate it throughout your entire system. When that pumping power weakens, blood begins to back up in the veins. Fluid then leaks out of those blood vessels and settles into the surrounding tissues. Because of gravity, that excess fluid is pulled downward, which is why the ankles and feet are almost always the first places where the problem shows up. Many seniors tell me their shoes suddenly feel tight, socks leave deep marks around the ankles, or their feet look puffy and shiny by the end of the day. Some notice that even after resting or elevating their legs, the swelling never fully goes away. This is a major red flag. According to the American Heart Association, persistent swelling in the lower extremities is one of the most common early signs of heart failure, yet it's also one of the most ignored. People blame hot weather, long periods of standing, or salt intake without realizing that the heart may be failing to move blood efficiently. There's a simple at-home check that can reveal how serious this swelling is. Gently press your finger into the swollen area near your ankle for a few seconds, and then release. If an indentation remains for 5 to 10 seconds, this is called pitting edema. Pitting edema strongly suggests fluid overload, often related to heart dysfunction. The longer this fluid sits in your tissues, the more strain it puts on your heart and blood vessels. Over time, the skin stretches, circulation worsens, and the risk of infections and ulcers increases, especially in older adults. What makes this symptom particularly dangerous is how quietly it progresses. You may not feel pain at first. You may simply notice heaviness, stiffness, or discomfort when walking. But inside, the heart is working harder and harder to compensate. Without treatment, this fluid buildup can spread upward, affecting the legs, abdomen, and eventually the lungs, leading to shortness of breath and emergency situations. Persistent swollen ankles and feet are not something to watch and wait on. They are your body's way of waving a warning flag and asking for attention before a much bigger crisis occurs. Symptom number 2. Swelling that worsens. Throughout the day, when swelling in your legs or feet starts off mild in the morning but steadily worsens as the day goes on, your body is sending a very specific message that should not be ignored. This pattern is not random, and it's not simply the result of being on your feet too long. It's closely tied to how gravity affects fluid movement when the heart is no longer pumping efficiently. Early in the day, after you've been lying down all night, fluid is more evenly distributed throughout your body. But as you sit, stand, and move upright, gravity pulls that fluid downward. If your heart is strong, it pushes blood back up against gravity without difficulty. When it's weak, that return flow slows and fluid begins to pool in the lower legs, ankles, and feet. Many seniors notice that their legs feel normal when they wake up, but by afternoon or evening, their shoes feel tight, their ankles look thick, and their legs feel heavy or achy. This gradual buildup throughout the day is one of the classic early patterns of heart-related fluid retention. Doctors at the Mayo Clinic describe this worsening daily swelling as a hallmark sign of developing heart failure. Unfortunately, because it develops slowly, people often normalize it. They assume it's due to fatigue, warm weather, or simply getting older, and they put off getting checked. The danger of this kind of swelling is that it rarely stays limited to the legs. As the heart continues to struggle, pressure builds in the veins, and fluid accumulation becomes more widespread. What begins as evening ankle swelling can progress to swelling in the calves, knees, abdomen, and eventually the lungs. When fluid reaches the lungs, breathing becomes more difficult, especially at night. This is why daily worsening swelling should never be ignored, even if it seems mild at first. Another important detail is that this swelling often improves temporarily when you lie down, which can give a false sense of reassurance. But improvement overnight doesn't mean the problem is gone. It simply means gravity has shifted the fluid again. The underlying issue remains a heart that's having trouble keeping up. If you notice this pattern happening regularly, it's not something to wait out. It's a sign to talk to a doctor early, while there's still time to slow progression and protect your heart. Symptom number 3, sudden weight gain, 2 to 5 lbs in days, plus leg swelling. When you see the number on the scale jump suddenly by 2, 3, or even 5 pounds in just a few days, especially when your legs or ankles are swelling at the same time, this is not normal weight gain. This is one of the most important and urgent warning signs that your heart may be struggling. I want to be very clear here. This kind of rapid weight gain is almost never caused by eating more food or slowing down. It's caused by fluid. When the heart weakens, it can't pump blood forward with enough force. As a result, the kidneys receive less blood flow and mistakenly think the body is dehydrated. In response, they hold onto salt and water, causing fluid to build up quickly inside the body. That extra fluid has to go somewhere. Gravity pulls much of it into the legs, ankles, and feet, which is why sudden weight gain and leg swelling so often appear together. Many seniors don't connect these two signs. They might notice their legs look puffier but assume the scale change is just fluctuation. According to the American Heart Association, gaining 2 to 3 pounds in a single day or 5 pounds in a week due to fluid retention is a major warning sign of worsening heart function. Doctors consider this an alert that the heart is under stress and may be failing to keep up. What makes this symptom especially dangerous is how fast it can escalate. Fluid doesn't just stay in the legs. As it continues to accumulate, it can move into the abdomen, causing bloating and discomfort, and eventually into the lungs. When fluid reaches the lungs, breathing becomes harder, especially when lying down, and the risk of emergency hospitalization rises sharply. Many heart failure admissions begin with nothing more than a few days of sudden weight gain that went unnoticed or ignored. This is why doctors often tell heart patients to weigh themselves daily. The scale can reveal trouble before severe symptoms appear. If you notice rapid weight gain paired with leg swelling, it's not something to wait and see. It's your body asking for help. Catching this early can prevent serious complications, protect your heart, and keep you out of the hospital. Symptom number 4, heavy, tired legs. Overall fatigue. When your legs start to feel unusually heavy, weak, or tired, and that exhaustion seems to spread through your entire body, this is not just slowing down with age. This kind of fatigue has a deeper cause, and very often it points back to the heart. A healthy heart pumps oxygen-rich blood to your muscles so they can work efficiently. When the heart weakens, that supply drops. Your leg muscles, which are among the largest and most active in the body, feel the effects first. Even short walks can start to feel draining, and activities that were once easy suddenly require much more effort. Many seniors describe this feeling as walking with weights attached to their legs, or feeling like the energy drains out of them far too quickly. They may need to sit down often, feel breathless with mild activity, or avoid movement altogether because it feels overwhelming. Experts at Harvard Health explain that unexplained fatigue and exercise intolerance are among the most commonly overlooked early signs of heart failure. Because the change happens gradually, people adapt to it without realizing something serious is developing. The problem with this kind of fatigue is that it creates a vicious cycle. As movement becomes harder, activity levels drop. Muscles weaken, circulation slows further, and the heart has to work even harder to meet the body's needs. Over time, this leads to greater weakness, balance problems, and a higher risk of falls. What started as mild leg tiredness can quietly turn into loss of independence if the underlying heart issue isn't addressed. This fatigue is often worse later in the day or after standing and walking, when fluid has pooled in the legs and circulation is even more strained. Rest may help temporarily, but it doesn't solve the root cause. If your legs feel heavy for no clear reason and your overall energy keeps declining, it's not something to ignore or push through. It's a sign to talk to a doctor, get your heart checked, and take action early. Treating the heart can restore circulation, improve energy, and help you regain strength and confidence in daily life. Symptom number 5, cold feet or toes, even in warm rooms. When your feet or toes feel cold all the time, even when the room is warm and others around you are comfortable, this can be more than just sensitivity to temperature. Persistent coldness in the feet is often a sign that blood isn't reaching your extremities the way it should. The heart's job is to pump oxygen-rich blood to every part of the body, including the farthest points like the toes. When the heart weakens, it has to make difficult choices. To protect vital organs such as the brain and heart itself, the body reduces blood flow to the hands and feet. As a result, the feet can feel cold, numb, or look pale and slightly bluish. Many seniors brush this off as poor circulation or aging, but the pattern matters. If your feet are cold most of the time, especially when paired with swelling, fatigue, or shortness of breath, it may point to reduced cardiac output. This means the heart simply isn't pumping strongly enough to push warm, oxygenated blood to the lower extremities. Medical professionals frequently see this in people with developing heart failure, long before more obvious symptoms appear. Cold feet can also signal that blood is moving more slowly through the veins, which increases the risk of fluid buildup and swelling. Sluggish circulation deprives tissues of oxygen and nutrients, making the skin more fragile and slower to heal. Over time, this can lead to cracked skin, sores, or infections that take longer to resolve. In older adults, even minor foot problems can become serious if circulation remains poor. Another important detail is that warming the feet externally with socks or blankets may bring temporary comfort but doesn't fix the underlying issue. The real problem is internal circulation, not room temperature. If you notice that your feet are consistently cold while the rest of your body feels normal, it's worth paying attention. This is especially true if the coldness is new or getting worse over time. Persistent cold feet are your body's way of signaling that blood flow is being compromised. Addressing heart health early can improve circulation, restore warmth to the extremities, and prevent more serious complications. Ignoring this sign allows the problem to progress quietly, often until much more severe symptoms develop. Symptom number 6. Nighttime leg cramps or restlessness. Waking up at night with painful leg cramps, twitching muscles, or an uncontrollable urge to move your legs is more than just an inconvenience, especially when it happens often. Many seniors assume nighttime leg cramps or restlessness are caused by dehydration, low minerals, or sleeping in the wrong position. While those factors can play a role, recurring nighttime leg problems can also be an early sign that the heart is under strain. The connection lies in how fluid and blood flow shift in the body when you lie down to sleep. Throughout the day, fluid tends to pool in the legs due to gravity, especially if the heart isn't pumping efficiently. When you lie flat at night, that pooled fluid moves back into the bloodstream. This sudden shift can disrupt circulation and alter electrolyte balance, which can trigger cramps, muscle tightening, or restless sensations in the legs. Many people with early heart failure report that their leg discomfort is worse at night, even before they notice major swelling or breathing problems. Poor circulation also means the leg muscles and nerves may not be receiving enough oxygen during the day. At night, when the body is trying to recover, these stressed muscles can react with cramping or involuntary movements. Restless legs can feel like a deep, uncomfortable urge to move, stretch, or walk just to find relief. Over time, this disrupts sleep, leading to chronic fatigue, irritability, and reduced ability to cope with daily activities. Lack of quality sleep places even more strain on the heart. When sleep is broken night after night, blood pressure regulation, hormone balance, and overall cardiovascular health suffer. What begins as just leg cramps can quietly contribute to worsening heart function if the underlying cause isn't addressed. If nighttime leg cramps or restlessness are becoming frequent, especially alongside swelling, fatigue, or cold feet, it's important to look beyond simple explanations. Treating heart-related circulation issues can often reduce these nighttime symptoms. Paying attention to what happens to your body at night can provide valuable clues about your heart health and help you take action before more serious problems develop. Symptom number 7, slow healing cuts or sores on feet next to your legs. When small cuts, scrapes, or sores on your feet or legs take an unusually long time to heal, it's a sign that something deeper may be going on inside your body. Healing is a process that depends heavily on good blood flow. Your heart must pump enough oxygen-rich blood to the skin and tissues so they can repair themselves. When the heart weakens, circulation slows, especially to the lower parts of the body. As a result, even minor injuries on the feet or legs can linger for weeks instead of days. Many seniors notice a tiny scratch from a shoe, a nick from trimming toenails, or a small sore that just doesn't seem to close. There may be redness that fades slowly, scabbing that repeatedly breaks open, or tenderness that doesn't improve. This delayed healing is often blamed on thin skin or aging, but poor circulation from heart problems is a major contributor. When tissues don't receive enough oxygen and nutrients, the body simply can't repair damage efficiently. Slow healing also raises the risk of infection. Bacteria can easily enter through open skin, and with reduced blood flow, the immune system has a harder time fighting it off. In older adults, infections in the feet or legs can spread quickly and become serious, sometimes leading to hospitalization. What started as a small sore can turn into a major health issue if circulation isn't improved. Another concern is that chronic swelling, which often accompanies heart problems, stretches the skin and makes it more fragile. Stretched skin is easier to injure and harder to heal. Over time, repeated wounds or ulcers can develop, especially around the ankles and lower legs. These are warning signs that the heart and circulatory system are under ongoing strain. If you notice that cuts or sores on your feet or legs are healing very slowly or not at all, it's important to look beyond surface treatments. Moisturizers and bandages may help protect the skin, but they won't fix the underlying circulation issue. Addressing heart health can improve blood flow, speed healing, and reduce the risk of infections and long-term complications. Symptom number 8, numbness, tingling, or pins and needles in feet. When your feet begin to feel numb, tingly, or like they're filled with pins and needles, it's easy to assume the problem is nerve-related or simply part of getting older. Many people immediately think of diabetes or back issues, and while those can certainly cause these sensations, they're not the only explanations. Reduced blood flow from a struggling heart can also deprive nerves of the oxygen and nutrients they need to function properly. When nerves don't get enough circulation, they start to misfire, sending abnormal signals that feel like tingling, burning, or numbness in the feet and toes. These sensations often start subtly. You may notice occasional tingling after sitting for a while or a slight numbness that comes and goes. Over time, it can become more persistent, affecting balance and making it harder to feel the ground when you walk. This increases the risk of trips and falls, especially in seniors. Poor circulation also means the feet may feel weak or clumsy, adding to a general sense of instability. When the heart can't pump efficiently, blood flow to the extremities slows. The body prioritizes vital organs, and the nerves in the feet are among the first to suffer. This lack of consistent oxygen supply irritates nerve endings and disrupts normal sensation. Swelling in the legs can make the problem worse by putting pressure on nerves, further contributing to numbness and tingling. What makes this symptom especially tricky is that it's often painless. Because there's no sharp pain, people ignore it or adapt to it. But numbness reduces your ability to feel injuries, pressure points, or temperature changes. A blister or cut may go unnoticed, and combined with poor circulation, can lead to infections or slow healing. If tingling or numbness in your feet is becoming frequent or worsening, especially alongside swelling, fatigue, or cold feet, it's worth looking at heart health as a possible cause. Improving circulation by addressing the underlying heart issue can often reduce these sensations. Paying attention to what your feet are telling you can help prevent more serious problems and protect your mobility and independence. Symptom number 9, swollen legs, plus. Shortness of breath. When lying flat, When your legs are swollen and you find yourself struggling to breathe when lying flat, or needing extra pillows just to sleep comfortably, this is a serious warning sign that your heart may be under significant strain. Swelling in the lower extremities alone can indicate fluid buildup due to a weakening heart, but when it is paired with shortness of breath while lying down, it often signals that fluid is not just staying in the legs, it is backing up into the lungs, a condition known as pulmonary congestion. This happens because a failing heart can't pump blood forward effectively, causing pressure to build in the veins and forcing fluid to leak into surrounding tissues, including the lungs. The result is difficulty breathing, especially when lying flat, and the need to prop yourself up with pillows just to get comfortable. Many seniors dismiss this combination as normal aging, asthma, or even seasonal allergies. However, the American Heart Association warns that swollen legs combined with shortness of breath when lying flat is one of the strongest indicators of heart failure. This is not a subtle symptom. If ignored, fluid accumulation in the lungs can worsen rapidly, making daily activities like walking or climbing stairs exhausting and even dangerous. People may notice waking up at night gasping for air, a racing heart, or feeling unusually fatigued, early signs that the heart is struggling to maintain circulation. This symptom also creates a feedback loop that strains the heart further. Swollen legs indicate fluid retention, which increases the workload on an already weakened heart. Pulmonary congestion limits oxygen intake, leaving muscles and organs deprived of oxygen. Over time, this reduces stamina, weakens the body, and increases the risk of serious complications or hospitalization. If you are experiencing leg swelling and shortness of breath when lying down, it's crucial to act immediately. This is not something that can be ignored or treated with home remedies alone. Early medical evaluation, monitoring, and intervention can prevent fluid buildup from worsening, protect lung function, and stabilize heart health. Recognizing this symptom combination early gives you the chance to take control and protect your quality of life. Symptom that just are 10. Skin changes on legs, feet, shiny, tight hair loss. When the skin on your lower leg starts to look shiny, tight, or even begins losing hair, it may seem like a cosmetic issue at first, but it's actually a strong warning sign that your heart could be under strain. Chronic swelling in the legs caused by fluid retention from a weakening heart stretches the skin over time. This constant pressure not only makes the skin appear glossy or taut, but also compromises its ability to heal and regenerate. When circulation is poor, nutrients and oxygen have a harder time reaching the skin and hair follicles, which can result in thinning hair or hair loss on the lower legs. Many seniors notice these changes gradually. They may wake up one day to see that the skin on their shins feels unusually tight or looks unusually smooth, or they may notice patches of hair missing that weren't there before. Because it develops slowly, it's easy to dismiss these signs as just aging or dry skin. However, medical experts at the Cleveland Clinic link these visible changes to long-term heart strain. They indicate that the heart's weakened pumping ability is affecting circulation, meaning tissues in the lower legs aren't getting the blood, oxygen, and nutrients they need to remain healthy. This symptom is especially concerning because poor skin and hair health often come with other hidden dangers. Fragile, stretched skin is more prone to cuts, sores, or infections. These injuries may heal slowly due to reduced blood flow, creating a cycle of worsening tissue damage. Over time, minor injuries can become serious complications, particularly in older adults if the underlying cause, heart dysfunction, isn't addressed. If you notice shiny, tight skin or hair loss on your lower legs, it's important to see a doctor rather than assuming it's just cosmetic. Addressing heart health, improving circulation, and reducing chronic swelling can restore skin integrity, prevent infections, and protect your overall mobility and quality of life. This is one of those silent signals your body gives, quietly indicating that the heart is struggling to keep up. Symptom number 11. Leg pain or aching. When walking, not just cramps, when you notice aching, heaviness, or pain in your legs while walking, and it eases when you rest, this is not simply a sign of getting older or minor muscle fatigue. This symptom can actually indicate serious underlying problems with circulation that are often tied to heart health. When the heart isn't pumping efficiently, blood can begin to back up in the veins, increasing pressure in the lower extremities. At the same time, poor arterial flow means your muscles aren't receiving enough oxygen-rich blood to support activity. The combination of fluid buildup and reduced oxygen delivery causes the legs to feel heavy, tired, or even painful during movement. Many seniors dismiss this sensation as normal aging or attribute it to arthritis or overexertion. However, when leg discomfort consistently appears during walking or activity, but improves with rest, it's a classic sign of poor circulation. This is often overlooked because it doesn't cause constant pain, and the relief from resting creates a false sense of reassurance. Yet the underlying problem, whether it's backup pressure in the veins, arterial insufficiency, or early heart failure, remains untreated and can progress over time. This kind of leg pain can significantly impact daily life. People may start avoiding walks, climbing stairs, or standing for long periods. Reduced activity further weakens leg muscles and decreases overall circulation, creating a vicious cycle that puts additional strain on the heart. Over months or years, this can lead to decreased mobility, fatigue, and an increased risk of falls or injuries. If you experience leg pain or heaviness during walking, especially when accompanied by swelling, cold feet, or fatigue, it's essential to consult a doctor. Proper evaluation can identify whether heart function or circulation is the underlying cause. Early intervention through medication, lifestyle changes, or vascular support can relieve symptoms, improve blood flow, and protect your legs and heart from further damage. Leg pain while walking is your body's way of signaling that the heart and circulatory system need attention. Listening to it early can make a life-changing difference. Symptom the 12. Puffy face abdomen in morning plus. Shifting to legs by day. When you wake up in the morning and notice that your face or abdomen looks unusually puffy, and then see that swelling shifts into your legs as the day goes on, this is a key warning sign that your body is struggling to manage fluid properly. This type of fluid retention occurs because the heart isn't pumping efficiently. Overnight, while you're lying down, fluid spreads more evenly throughout the body, which can cause the face, eyelids, or abdominal area to appear swollen. When you get up and start moving around, gravity pulls that same fluid down into the lower extremities, leading to swelling in the legs, ankles, and feet. This shift may seem harmless at first, but it actually represents a vicious cycle of fluid imbalance that is commonly associated with heart failure. Many seniors dismiss morning puffiness in the face or abdomen as normal aging or a result of eating late at night. However, persistent fluid shifts are rarely trivial. The heart's weakened pumping ability fails to move blood efficiently, causing the kidneys to retain water and salt. Over time, this fluid accumulation can lead to chronic swelling, discomfort, and pressure on the circulatory system. Left unaddressed, it can progress to more serious complications, including pulmonary congestion, shortness of breath, and additional strain on the heart. The pattern of morning puffiness moving downward is particularly telling because it reflects how gravity interacts with a failing cardiovascular system. While the face may appear normal by midday, the fluid has merely been redistributed to the legs, which then become swollen, heavy, or uncomfortable. This is why monitoring not just leg swelling, but also morning facial or abdominal puffiness is crucial for early detection of heart problems. If you notice this cycle, it's important to consult a doctor promptly. Early evaluation can include checking heart function, monitoring fluid retention, and addressing underlying issues before serious complications develop. Recognizing morning puffiness that shifts downward is more than cosmetic. It's your body signaling that your heart needs attention. Acting on this early can protect your health, reduce discomfort, and help prevent more severe heart-related problems.